Good afternoon. Subcommittee will come to order. The chair recognizes himself for an opening statement. Today, the subcommittee will consider 5 bills to help first responders care for patients in an emergency situation, better coordinate care for patients with complex metabolic and autoimmune diseases such as diabetes, improve access to maternity care to assist efforts in recognizing and referring cases for mental health services, and reauthorize nurse education programs. Throughout my tenure as chairman of this important health subcommittee, one of my top priorities has been to work diligently on behalf of the American people to improve their access to vital health care, as well as the delivery and affordability of those health care services. Today, our subcommittee is marking up 5 separate bills, each of which is directed towards those very aims. H.R. 4365, Protecting Patient Access to Emergency Medications Act, 2016, was introduced by Representative Richard Hudson, North Carolina, and amends the Controlled Substances Act in order to allow paramedics and other emergency service professionals to continue to administer controlled substances to patients pursuant to standing orders. This legislation is necessary to ensure patients will continue to receive life-saving medications. H.R. 1192, National Clinical Care Commission Act, sponsored by Representative Pete Olson of Texas, was the subject of a health subcommittee hearing just last week and will be part of an amendment in the nature of a substitute that simply expands the focus of the commission beyond diabetes to include complex metabolic-related autoimmune diseases. This legislation will enhance our ability to evaluate and recommend solutions to better coordinate care and leverage the numerous federal programs that support clinical care for patients with these types of illnesses and disorders. H.R. 1209, Improving Access to Maternity Care Act, introduced by Representative Michael Burgess of Texas, will increase data collection to better place maternal health professionals in more appropriate geographic regions and mitigate health professional shortages through their existing participation in the National Health Service Corps. H.R. 1877, Mental Health First Aid, sponsored by Representative Lynn Jenkins of Kansas, requires Substance Abuse Mental Health Services Administration to award grants to initiate and sustain mental health awareness training. The goal of such training is to de-escalate crisis situations, recognize signs and symptoms of mental health, and encourage timely referral to mental health services. Lastly, H.R. 2713, Title VII Nursing Workforce Reauthorization Act, 2015, introduced by Representative Lois Capps. California reauthorizes grants and scholarships for graduate and undergraduate nursing education programs. I support each of these bills and urge their adoption by the subcommittee, and I now recognize the gentleman from Texas, Mr. Green, for 5 minutes for his opening statement.
Thank you, Mr. Chairman. Before I give my statement, I'd like to ask unanimous consent for our ranking member statement to be placed into the record.
Without objection, so ordered.
Thank you, Mr. Chairman, for calling this hearing, and I know we had our legislative hearing last week. The Health Subcommittee is marking up 5 bipartisan bills to improve public health, support our health system, and ensure we continue to invest in workforce development. These bills are Protecting Patient Access to Emergency Medications Act, the National Diabetes Clinical Care Commission Act, the Improving Access to Maternity Care Act, and the Mental Health First Aid Act, and the Title VIII Nursing Workforce Reauthorization Act. Add to this committee's record of moving bipartisan legislation. I want to thank the sponsors and leaders on this committee for advancing each bill. H.R. 4365, Protecting the Patient's Access to Emergency Medication Act, led by Representative G.K. Butterfield and Richard Hudson, will clarify that emergency service personnel can administer controlled substance under a standing order from an EMS medical director. Codifying this current practice will ensure that patients have timely access to often life-saving drugs in an emergency situation, and our EMS providers can deliver such care in a safe manner. H.R. 1192, the National Diabetes Clinical Care Commission Act, is championed by members from our committee, Representative Pete Olson and Dave Loebsack. The bill will establish a National Diabetes Clinical Care Commission to improve health care for individuals with diabetes and associated conditions. More than 29 million Americans are living with diabetes, and almost 90 million more are pre-diabetic. According to the Centers for Disease Control, more than 20% of all health care spending is for people with diagnosed diabetes. This commission will enable us to coordinate efforts and leverage precious resources, which would allow us to better address the economic and human impact caused by diabetes and other disorders. H.R. 1209, Improving Access to Maternity Care Act, is sponsored by Representative Mike Burgess and Lois Capp, both on our committee. This legislation aims to expand access to maternity care services by better identifying areas with maternity care shortage. Under this bill, we will be able to identify what constitutes a shortage of providers of maternity services and identify geographic shortage areas within the existing primary care health professional shortage areas designation. H.R. 1877, the Mental Health First Aid Act, is an important bill to allow continued funding of the Mental Health First Aid Act grant programs. It's sponsored by Representative Doris Matsui and Lynn Jenkins. Mental health first aid investments enable law enforcement and first responders, teachers, and members of the community to receive training on appropriate responses to an individual experiencing an episode of mental illness. To date, nearly 375,000 people have been trained in mental health first aid through these grants. This legislation builds on a success track record of supporting evidence-based programs and makes target improvements so that it can better serve those struggling with mental illness. H.R. 2713, the Title VIII Nursing Workforce Reauthorization Act, will reauthorize and update nurse workforce programs under Title VIII, which supports nurses practicing in medically underserved areas and rural areas, advanced education nursing, the National Nurse Service Corps, nurse faculty loan forgiveness, and diversity grants. Title VIII programs have long-standing history of bipartisan support and real-world impact. Nurses play a critical and growing role in our healthcare system, and this bill ensures our key investments in the nursing workforce will continue in a manner that reflects advances in the field of nursing. I want to particularly thank our colleague, Representative Lois Capps, for sponsoring this legislation and for her timeless champion of nursing and patients they serve. I'm pleased to support all the bills we are considering today. I want to thank all the sponsors for their commitment and efforts to improve our health, public health, and access to care. And, Mr. Chairman, I yield back.
Chair, thanks, gentlemen. And now recognize the gentleman from Florida, Mr. Bilirakis, 3 minutes for an opening statement.
Thank you, Mr. Chairman. I appreciate it so very much. Again, and also thank the ranking member for bringing these 5 bills up for markup. I want to highlight a couple bills. I'm a co-sponsor of H.R. 4365, Protecting Patient Access to Emergency Medications Act. This legislation will clarify current law to allow EMTs to administer controlled substances, such as painkillers and anti-seizure medications, under the supervision of a physician using standing orders. Without this legislation, we risk sacrificing emergency medical care and patient safety because the laws and regulations cannot keep up with modern medicine. It's a needed piece of legislation, as DEA is reviewing current law and proposing regulations that may have detrimental effects on the quality of care in emergency medical services. I'm also glad to see another bill that I co-sponsored, H.R. 1192, the National Clinical Care Commissions Act, advanced through the committee process. There are many agencies that provide programs and services for various diseases. For example, there are 35 federal departments, agencies, and offices involved in the implementation of federal diabetes activities. A National Clinical Care Commission would evaluate policies and recommend solutions to provide better coordination for complex metabolic and autoimmune diseases or diseases related to insulin deficiency. This would promote better outcomes while potentially providing savings as duplicative or underachieving programs could be eliminated. These bills will provide better outcomes and better care for patients, and support the passage of these bills. I look forward to their consideration. And I yield back. Thank you, Mr. Chairman.
Sure, thanks, gentlemen. Now recognize the gentlelady from California, Ms. Matsui, 3 minutes for opening statement.
Thank you, Mr. Chairman. I'm pleased that among the bills we're considering today is legislation I co-authored with my colleague, Congresswoman Jenkins, H.R. 1877, the Mental Health First Aid Act. For too long, mental health has been in the shadows, and that stigma has prevented both patients and their loved ones from seeking help. We need to equip our first responders, community members, and law enforcement personnel with the training they need to appropriately respond to someone struggling with a mental illness. Mental health first aid courses provide that information and support to the people on the ground who need it the most. In my district, we are already seeing incredible results of the mental health first aid program. I recently visited a training program in Sacramento and was so impressed by the level of knowledge of the instructors and the willingness of the participants to learn. This really touches us all. Everyone knows someone who is struggling with a mental illness, and people want to help. But because of stigma and lack of awareness, many do not know how. Mental illness first aid provides us with those tools so we can support loved ones and community members at the first sign of trouble and get them the help they need proactively. I also want to point out that September is Suicide Prevention Month. Every hour, 5 people die by suicide in the United States, including 1 veteran. These aren't just statistics. These are brothers, daughters, parents, and friends. It takes just one person to reach out and help someone in crisis. And the mental health first aid courses that would be supported with this bill can provide the resources people need to do so. The Mental Health First Aid Act that we are considering today would reauthorize mental health awareness training programs to help emergency services personnel, police officers, educators, and the public identify, understand, and respond to mental health issues and disorders. Earlier this year, we took a step forward by passing mental health legislation out of this committee. Passing this legislation would be another step in the right direction toward comprehensive mental health reform. I'm thankful to Congresswoman Jenkins for all of her work on this and look forward to continuing to work with members to pass this legislation through committee and onto the House floor. And I urge my colleagues to vote yes on H.R. 1877, the Mental Health First Aid Act. Thank you, Mr. Chairman, and I yield back.
Chair thanks, gentlelady. Now recognizes the gentlelady from California, Ms. Capps. 3 minutes for opening statement.
Thank you, Mr. Chairman and Ranking Member Green, for holding this markup. And while each of the bills we will consider has merit, I'd like to take the opportunity to highlight the importance of 2 specific bills that I've introduced to improve the healthcare workforce and improve access and care for patients. As has been mentioned, I'm proud to have worked closely with Dr. Burgess to co-author H.R. 1209, the Improving Access to Maternity Care Act. We know that access to maternity care, including preconception, prenatal, and postpartum care, is critical to ensuring healthy moms and healthy babies. But far too many communities struggle with the lack of qualified maternity care providers. And while maternity care professionals are included in the program, they aren't necessarily being placed in the areas with the highest need. Our bill would shine a light on this issue and use data to help more accurately place maternity care professionals in the locations that need them the most. This is a targeted but meaningful change that can have significant impacts on communities, especially those that are underserved. We will also consider H.R. 2713, the Title VIII Nursing Workforce Reauthorization Act, which has been mentioned. And I'm so grateful to be joined by my Congressional Nursing Caucus co-chair, Representative David Joyce from Ohio, to lead this reauthorization effort. As many of you know, Title VIII is the primary program our nation has to strengthen and grow the nursing workforce by supporting nursing education at all levels, from pre-entry level preparation through graduate study. These programs have had bipartisan support for over 50 years, and the Nursing Workforce Reauthorization Act would ensure that these critical programs are available for years to come. So I urge support for these important programs, and I yield back the balance of my time.
Chair thanks the gentlelady. Chair now calls up H.R. 4365 and asks the clerk to report.
H.R. 4365, to amend the Controlled Substances Act with regard to the provision of emergency medical services.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. We are now on H.R. 4365, and the subcommittee will reconvene at 2 p.m. tomorrow. I remind members that the chair will give priority recognition to bipartisan amendments, and I look forward to seeing all of you tomorrow. Without objection, the committee stands in recess.